Hello, Paul Bowman here. If you don't know me already, I work with people one-on-one in the Winter Haven area that are struggling with joint pain and movement dysfunction. People for which conventional treatment has been ineffective and frustrating, to say the least. They feel like they've tried everything and nothing works. I help them get out of pain, go from dysfunction to functional, from functional to high performing. I do this by assessing their neurology and biomechanics and tailoring a rehab program that is tailored to their specific desires and needs. In this video, we are going to hear Christies' story of a series of accidents and treatments that led to many, many years of debilitating back pain. In the description for this video, you will also see a link to a page that will have a series of videos documenting Christies' assessments and rehab. All right, I'm here with Christy, and she is gonna tell us her story.
My story, I've always been a very hyperactive person, having a hard time sitting down. My first trauma was at 9 months, and I broke my skull and had to be in the hospital for a couple of weeks, and I was still trying to jump out of the bassinet. Then again at 12, I was trying to climb a 12-foot straight ladder, and my sister was holding it, and I'd just been to the circus, and I got to the top, and she couldn't hold it anymore, so of course it went straight over and broke my jaw, broke all my teeth out, a lot of facial trauma, a lot of plastic surgery. Third trauma, which was the biggest one, I was riding a bike in a race and was putting my water bottle back into the bike, and before I realized it, I had crashed into a chain link fence that was painted brown. Went over, hit my head, broke my helmet, hit my shoulder, broke my scapula and my clavicle, had a bone bruise on my hip, threw my back out. And since then, it's been surgery after surgery after surgery. I've had 11 back surgeries. I still have a lot of pain. I'm trying this because this is my last resort, basically, unless they want me to have they do want me to have another surgery. So I don't want to have another surgery. I want this man to help me out.
Yeah,
so that's why I'm here.
There's definitely, in addition to the stuff we filmed, as far as like connecting the brain to your back and your back pain and stuff like that, that's all accurate. But along with that, it does not neglect the fact that you've had a lot of body and head trauma. Yeah. And yes, so not surprisingly to me, what you're dealing with. And one of the things I said last time we talked about this, I said, I think if not earlier, a lot of this stuff started when you were 9 months old, and
I believe so as well.
Even if you didn't have any obvious immediate stuff after that, like unless that's seriously rehabbed, which it just typically is not,
right.
Then that stuff creeps up over the decades. Yeah. In the short time that you've worked with me, and actually it's just at this point one workshop and a couple of classes, like what have you come to realize?
I came to realize that this stuff really works. When I came in here the first day, I don't know if you remember, but I could not go on 2 feet because it hurt my back so bad. If I pushed on both feet at the same time, horrible pain. Now I can actually do jumping jacks and running in place. So
carefully,
carefully, yes.
Yeah, but no, it's,
gently.
Yeah. Yes.
But 1 foot on the floor and 1 up. So something's working. I don't totally understand it, but
towards anybody listening and watching, that's one of my jobs, is to get people to understand it. Mm-hmm. Towards that, and I was just saying, like, all the stuff that we've been talking about in this sequence of videos is extremely common for people that, especially, well, I'm going to say extremely common for people in chronic pain, but honestly, even just extremely common for, I'm going to say, 50-plus-year-olds in a modern society.
Exactly.
Along with that, it's almost never talked about, almost never looked at. It's completely overlooked. And all of it matters.
Yeah.
It's a huge discovery for myself in looking for the best stuff out there over the decades, and it has made a huge difference.
And tell me what the name of this.
So I study Z Health, and Z Health is basically applied neurology. So it's some of the best ways I understand it and able to get other people to understand it is to say, for you, it's mostly your back, but it could be somebody's shoulder, it could be somebody's knee, it could be somebody's hip, anything like that. So, and whenever I say this, there's always exceptions. There's great, amazing practitioners out there of all kinds. That said, as a society, we tend to, what tends to happen is you go and somebody just looks at your back. And rarely is the source of the problem just your back. And so somebody that's holistic, I would say, is the next level. Okay, I'm holistic. I look at the whole body. Okay, that's better than just looking at your back or just looking at your shoulder or just looking at your hip. But even then, that typically, without realizing it, that typically means, hey, I'm looking at you from the neck down.
Right.
Not including your nervous system or not including your brain. And then when you add the neurology part to it and really understand how to apply the neurology part to it, every posture, every movement you make is originated from the brain and coordinated from the brain. So the best way to address your back, the best way to address your shoulder, your hip, your knee, anything, is to, yes, look at all the body parts, but also to look at how it's being driven and coordinated from your brain. And if you fix something without doing that, you accidentally rehab the brain. So why not purposely rehab the brain and the body together?
Right.
Yeah. Now, sometimes people look at it like, hey, I've had these injuries. I got this herniated disc, or I got this tear in my shoulder, or I got this wear and tear. I got bone on bone in my knee. And I would say those are more symptoms than causes. So, yeah, do you want to address those things? Yes, but don't look at it like, hey, that's the source of the problem. This like for you, okay, sure. Do you have wear and tear in your back? Have you had things like arthritis or things like bulging discs or herniated discs? Sure, but so far, just a few of the things that could contribute to that. Okay, your brainstem, as far as autonomic tone, is not doing its job. So, all right, autonomic tone is not just a static thing, it's a dynamic thing, meaning like your brain should be constantly figuring out what's the appropriate flexion and extension for any posture, any movement. And if that's off, then things aren't going to move the way they're supposed to. Bones and joints are going to be out of place, and there's going to be wear and tear and stuff like that. So realizing that and, okay, let me fix my brain and my body so that I have the right posture, the right flexion, the right extension for any posture, any movement, and those things can heal up.
That makes sense. Like a top-down approach that everything originates up there. I mean, we do have injuries, but it's how we react to the injuries from our brain, or?
Yes. Yeah. So this one analogy is like the peeling the onion. So, all right, 9 months old, smash my head, concussion, facial injury, stuff like that. Okay, you compensated for that. Obviously, in some ways you might know, some ways you don't know, but you obviously compensated for that. Okay, without completely rehabbing that, those compensations carry forward. And as much as they compensate for the injury, okay, without good rehab, they're going to start causing something else to go wrong. All right, then you have another trauma or another injury. Okay, it's not completely rehabbed. All right, you have compensations from that. And when I say compensate, all right, things are out of balance, and I'm working with that imbalance, but really it's keeping you in balance because you continue to compensate.
Right.
And then your history, and I have a similar, different but similar history. Okay, you got layers and layers and layers of compensation that are keeping you out of balance. And so to now peel the onion and go, okay, let's rehab this piece, let's rehab this piece, let's rehab this piece. And towards all of those, okay, if you have any kind of acute or chronic body problem, challenge, dysfunction, however you want to put it, you're going to have a spot in your brain that has an acute or chronic dysfunction as well. You can't separate the two.
Okay.
Now, whether it started in your brain or started in your body, what it does chicken or egg doesn't really matter to me.
Right.
Like, either one sticks around long enough, and you're gonna have problems in both areas. So let's rehab both areas.
So the reverse of that would be that if you have a healthy body and you use the rehab on the brain, then you can have higher performance levels as an athlete.
Absolutely, and you just said something without me when you asked about, hey, what do I do as health, and it's applied neurology, and we're talking about applying it to injury and rehab and pain, but also the same stuff is often applied to high performance. So it's a whether you're a weekend warrior, amateur athlete, or a professional athlete. Yes, there are many professional athletes out there that are applying Z Health to their higher performance. Absolutely. So yes, and even versus say somebody like yourself. Okay, yes. Could you at the same time? Yes, you're rehabbing your body and your brain, and you're getting yourself out of pain. To continue that would just be like, okay, to go from dysfunction to function to high performance.
Mm-hmm.
Yeah.
Right?
Yes.
So there's still hope for the Olympics, right?
Sure.
In the senior games.
How does it feel to go through all this and have 11 surgeries and still feel the way you're feeling?
It feels very frustrating.
Yeah.
And very scary, because you trust your physicians and people to say the first time, okay, we're going to make you better. And that doesn't happen. And you go for another one. This time it's going to be better. So 11 times of that is very, very frustrating. And I develop a lack of trust. It's tough.
Yeah. And that's one of the big things that drives me is to get people beyond that frustration. They're stuck. They're stuck in their rehab. They're frustrated, and they said, not trusting that your healthcare professionals. It's not a good place to be.
It's not.
Now, anything healthy skepticism, sure, but not trusting them is not a good thing. But then to realize all this and go, okay, where am I going from here? And I've been trying to connect those dots, especially in the sequence of videos that I've shot with you and some others recently, is to say, like, okay, a specialist like a back surgeon can be amazing if everything else is working great. Mm-hmm. But as we've realized, that's often not the case. And for people that, for your, like, a situation like, all right, 11 surgeries, for people that keep going to this rehab didn't work, this rehab didn't work, this surgery didn't work, this, it is often because all these other systems are not being fixed and not being addressed.
Right.
Yeah. So to really look at all of that.
Mm-hmm. And unfortunately, in a specialist medical society now, no one's looking at the whole body.
Yeah, they get really amazing at one little piece. Mm-hmm. And yes, sadly, it has become a rare thing that somebody gets really good at looking at all the pieces. Mm-hmm. Yeah. If you are in the Winter Haven, Florida area, and you or a loved one is ready to do the work and take the next step toward making chronic pain and dysfunction a thing of the past, then simply just send me a text or give me a call at 863-845-0609, and I will get right back to you as soon as I can, and we will set up a free consultation. Talk to you soon.